All right, let's jump right in. And hey, Madi told us that you all really enjoyed the last few videos, so we're excited to bring you another one. Today, we're diving into a real-life medical mystery, a true head-scratcher. It's a story about a time when all the signs pointed to a patient getting better, but their lab tests started screaming that things were actually getting worse. We're going to explore this fascinating paradox of when a cure looks almost exactly like the disease.
So let me just ask you this. What if the very thing that was supposed to make someone better was actually making things look a whole lot worse? Imagine you're the doctor. Your patient feels great, their pain is gone, you even have a scan that shows the infection has cleared up. But then, the lab results hit your desk, and they suggest the infection is raging, maybe even worse than when you started. What do? This isn't just a hypothetical, you know. It's a real paradox doctors had to solve, and it all boils down to understanding the secret language hidden in our blood.
Okay, so let's get into the case. This whole story comes from a 2019 report out of the National Institutes of Health, and it is the perfect example of how numbers on a lab report, well, they don't always tell the whole story. Sometimes they tell a really, really baffling one.
So here's how it all went down. We have a 67-year-old man who gets this really nasty spinal infection after a surgery. It's serious stuff. We're talking an abscess forming right along the hardware in his spine. So the docs put him on a 2-month course of a heavy-duty IV antibiotic, vancomycin. And you know what? It works. 2 months go by, his awful back pain is totally gone. They do a follow-up CT scan, and yep, it confirms it. The abscess is gone, case closed, right? He's cured. But this is where the paradox hits. Right at that moment, his lab test for inflammation just goes through the roof. And I don't mean a little high. They're at levels that suggest the infection is back with a vengeance.
This is where the real detective work has to begin. To figure out this puzzle, the doctors had to take a hard look at the very tools they use to measure the body's secret battles, the tests that actually measure inflammation.
So let's do a super quick refresher here. Inflammation is just your body's army responding to an attack, whether that's an infection or an injury. When this happens, your liver starts pumping out these special proteins into your bloodstream, called acute phase reactants. Lab tests can then measure these proteins to get a sense of just how big the battle is inside you. Think of them like the body's own alarm system. Now, when it comes to checking these alarm signals, doctors have two main tools, and it helps to think of them as two totally different kinds of detectives. On one side, you've got the ESR, or erythrocyte sedimentation rate. Let's call this one the veteran. It's been around forever, it's dependable in some ways, but it's a bit old school, a little indirect. On the other side, you have CRP, C-reactive protein. This one is the first responder. It's modern, it's direct, and it is incredibly fast to react. And as you're about to see, the difference between these two is the absolute key to solving this mystery. So let's really get into the details in this tale of two tests. Because, you know, when you're trying to figure out what's happening inside a person's body in real time, the speed and the accuracy of your intel, well, it's everything. So our veteran test, the ESR, is actually pretty clever in a low-tech way. You take some blood, put it in a skinny tube, and just measure how fast the red blood cells fall to the bottom. See, when there's inflammation, certain proteins make the red blood cells get all sticky, clump together, and fall faster. So faster fall equals more inflammation. But and this is a huge but, it's an indirect measurement. It's slow to go up when a problem starts, and it can take weeks to come back down after the problem is gone. On top of all that, tons of other things can mess with the result. Your age, gender, anemia, even pregnancy. It's a clue for sure, but it's not a very specific one. And then there's our first responder, CRP. This test is way more direct. It actually measures a protein the liver starts churning out within hours of an infection or injury. Its levels can literally double every 8 hours, peaking in just a day or two. And just as important, as soon as the inflammation is handled, the CRP level plummets. It has a half-life of only about 18 hours. This makes it an absolutely fantastic real-time snapshot of what's happening right now, which is exactly why it's the go-to test for acute situations.
This chart just says it all, doesn't it? Look at the difference. CRP acts like a flash fire. It shoots up in about 48 hours to signal a problem, and then it's gone just as fast once the fire is out. It gives you this sharp, right this second picture. The ESR, on the other hand, is more like a slow burn. It rises gradually, smolders for a long time, and only fades back to normal over weeks. It tells you something was wrong, but it's not so great at telling you what's wrong today.
Okay, so we've met our detectives. Now let's get back to our patient. Remember, he feels great. His scan is totally clear, but his labs, including that super fast CRP, are sky high. It's time to solve this thing. The doctors were really in a bind here. All the physical evidence from the patient and the CT scan was screaming cured, but the lab evidence was screaming disaster. The key, though, was that they knew CRP was a real-time signal. So they reasoned, if the infection is truly gone, then something else must be causing this brand new wave of inflammation right now. They had to find another clue.
And boy, did they find one. Buried in the complete blood count was this jaw-dropping number. The patient's eosinophil count was over 6,000. Now, to give you some perspective, the normal range is somewhere between 40 and 500. This wasn't just a clue, this was the smoking gun. Eosinophils are a type of white blood cell that are basically the body's special forces for fighting parasites and, this is the important part, for responding to allergic reactions. A number this high was a massive red flag that the body was fighting a completely different war. So what on earth causes an eosinophil spike like that? Well, the case report itself gives us a list of suspects. You've got parasitic infections, allergies, some really serious stuff like leukemia, and then, right there in the list, drug reactions. All of a sudden, the cure itself, that powerful antibiotic, becomes the #1 suspect for causing a whole new problem. Let's just walk through this brilliant piece of deduction. Step 1, they trusted the patient and the scam. He felt better, the abscess was gone, so the infection was almost certainly cured. Step 2, they looked for new information. Turns out, the patient mentioned that right when his labs went crazy, he had developed a new skin rash and was itching all over. Step 3, they connected the dots. A rash, itching, a sky-high eosinophil count, that is the textbook trifecta for a drug-induced allergic reaction. Step 4, they had their culprit. The massive inflammation wasn't from bacteria, it was the patient's own body having a severe reaction to the very antibiotic that had saved. And wouldn't you know it, the theory was spot on. They stopped the vancomycin, and just 1 week later, his skin cleared up, and both his CRP and ESR levels dropped right back down to normal. The paradox was solved. The cure had perfectly mimicked the disease by kicking off its own brand new inflammatory storm. This whole case really points to a much bigger lesson, doesn't it? It just perfectly shows that lab tests are only one piece of a giant puzzle. They're incredibly powerful tools, but they're basically meaningless without context. The real art of medicine is about putting all those clues together. So you might be wondering, how often do these two tests disagree? Well, a study of over 800 patients in Alaska looked at exactly that. About half the time, they were both abnormal, and 20% of the time, they were both normal. So in about 70% of cases, they agreed. But look at this. In nearly a third of the cases, they told different stories. And the biggest chunk of that disagreement? 26% of the time, the fast-acting CRP was high, while the slow-moving ESR was still totally normal. This really shows you how often CRP is the first to sound the alarm on something ESR would have missed. So what's the big takeaway here? First, you gotta know your tools. CRP is your sensitive first responder. It's the best for spotting and tracking something happening right now. The ESR is your slow and steady veteran, which can be more useful for watching chronic conditions over a long time. But second, and this is the most important part, a high number on a lab report is not a diagnosis. It's a signal flare. It just tells you to look closer. And as this case showed us so brilliantly, if you misinterpret that signal, if you blame the old fire when a new one has just started, you can head down a completely wrong and potentially dangerous path. And that really leaves us with this one final thought. Your lab results are critical clues, but they are never, ever the final conclusion. They're just one chapter in a much bigger story that includes how a patient feels, their history, and a doctor's own clinical judgment. So the real question is, who is putting all those pieces together to read the whole story? It's just a powerful reminder of that human element that will always, always be at the very heart of medicine. Thanks for joining me.